Welcome to the Healthy Living webinar series, brought to you by Regional Health Center and Dr. Jen Lourey. This series is designed to empower you with simple, actionable tools to live a happier, healthier, wealthier, wiser, and kinder life. Each session will focus on a key pillar of wellness, whether it's nutrition, movement, mindset, stress resilience, or nervous system regulation. Our goal is to help you make lasting lifestyle changes that support your body's natural ability to heal and thrive. We believe true health is not about quick fixes. It's about building habits that align with how your body is designed to function. You'll walk away from each webinar with clarity, confidence, and step-by-step plans you can start using immediately. Let's shift from reactive to proactive. Let's choose health on purpose. We're so glad you're here.
We'll go ahead and get started. People who are online, I'm actually speaking to the audience, and so my eyes are going to come off of you, and there will be some questions, possibly from the actual humans in the room with me. So my apologies if this is distracting at all, but there's a lot of great information in here. Hi, I'm Dr. Jen. If you're physically here, you probably know who I am. I've been practicing in chiropractic since 1994, which gives me, a great amount, and you're welcome to talk out there too. It gives me a great amount of time of knowledge to draw from, and I have my own children. So on top of it, real life experience, and there is nothing better. So don't think I can't relate. I absolutely can. As we go through, there are no questions that are off topic. Please go ahead and ask. Again, if you're just joining us, shut those phones off, full attention, watch all the way through to the end, dedicate some time. Most of the time, it's just a daily struggle to even find time to dedicate for yourself or for things like this. So that's the first step. Many people can want to do things, but taking action is a different beast. Taking action is what actually gets you to the end. So thank you for being here tonight. Thank you for taking that action. This really is something that our culture has created, is go from one thing to the next, to the next, to the next. And what I'm going to teach tonight is what's called a pattern interrupt, because we can call it genetics, we can call it culture, we can call it learned behavior, we can call it many things. What you need to do is interrupt that so that you can clearly think from this point forward. The whole RHC team and I are focus for 2025 is what's called generational health. 2024 was generational trauma, and we realized that we're perpetuating it by talking about it. So now we're not going to talk about it. We're talking about generational health and going forward. And you're going to learn some of those things tonight, which is super important because we're talking about generations and we want generational health. So what you will learn tonight is that the body never does anything wrong. This is an intelligent creature, and it always is working towards surviving. It doesn't do things to try to destroy you. The genetic illnesses that are out there are like 0.03% of illnesses. We're looking at the body continually trying to save itself and trying to recover. It's just there's a lot of stuff coming at us continually. We're going to teach you about adaptability and resilience tonight. We're going to begin with the best trick. We teach all of our patients this. It's a 1-minute exercise. And as we're doing the exercise, we're all going to do it together. As we're doing the exercise, I will explain why we're doing the exercise. Part of the reason is just I need these brains to open up, and I need you to absorb everything I'm telling you tonight. And if you are like 99% of the people out there, you're functioning at that sympathetic fight or flight mode, just like your kids are. So what I want you to do is lock those fingers together. You're going to put your hands behind your head. You can be sitting, you can be standing, you can be lying down. The only reason for the hands behind the head is a little biofeedback with crossing your fingers, but mostly it's so that you keep your head in the center. And this exercise is as simple as move your eyes one side or the other as far as you can. I'm going to the left. Does not matter which side is first. You stay there for 30 seconds. I'm going to drop out of this. You stay right where you are. I am counting for you. Stay there for that 30 seconds, and I'll explain why. When we were wired, when our nervous system was created and our nervous system starts growing, remember, we've been here for thousands of years. And so our nervous system was designed originally to protect us. So fight or flight mode. I know your eyes are getting tired. That's a part of this because we don't have peripheral vision anymore. Everything is right in front of us. All of the screen time, we even have backup cameras in our car, so we don't have to use our peripheral vision. It was there to keep us safe. It was there to watch when prey was coming. And so that our body immediately got ramped up into that fight or flight mode or that sympathetic response. The problem is in our culture, we're caught there and we're stuck there. Okay, your hands stay there, your head stays there, your eyes just go the opposite direction for another 30 seconds. So look the other direction as far as you possibly can. What my suggestion is that you do this before you fall asleep, right away when you wake up in the morning. It'll give you deeper sleep and it'll actually start your day out in that rest and digest mode. What this exercise is doing is affecting the vagus nerve. It's bringing you from that fight or flight mode into the rest and digest mode, or sympathetic response into parasympathetic response. Understand your body's going to want to flip right back into that sympathetic response. This is an exercise. You have to do it repeatedly so that your body understands this and holds this. Okay, I want you to blink your eyes, drop those arms down, take a deep breath in and just blow that air out. Your body should settle. Should be in more of a rest and digest, focus and learning phase. This is really important because I want to share information with you and I want you to absorb it. That vagus nerve affects, and we'll talk about this as we're going through the seminar, that vagus nerve affects not only your concentration, but your cardiovascular system, your digestive system, your cortisol, the HPA axis system affects all of that. So you can see how powerful this is. It was 1 minute. It just takes 1 minute to reset that system. I want you to start teaching this to your children, and I want you to start doing this on a daily basis. That's huge. We're going to go over a couple of stats. So currently, we'll get off of that, 1 in 7 children have a mental health diagnosis. That freaks me out. That's crazy. This is for many reasons. We've started to understand mental illness better. There are more codes, so we can diagnose. Among adolescents, roughly 1 in 5 experience depression in any given 2-week period. 1 in 7, again, or sorry, 1 in 5. That boggles my mind. And I didn't look up the statistics, but I also think that transfers over into what adults experience too. And we're seeing it more and more and more. 8 to 14% of children and teens across different surveys are on prescription mental health medications. So up to 14% of kids are on medications, not for all health conditions, just for mental health conditions. Treatment access, over 80% of children have received some form of support for mental illness. 80% of our kids. This is just crazy to me. What's the answer? How do we fix this? Is more medication the answer? I'd like to give you and remind you of the definition of what crazy is. Does anybody know it? Crazy, the definition of crazy? Keep doing the same thing over and over again and expecting different results. Definition of crazy. And so do we keep doing the same thing that we're doing? Well, all of the methods that we're doing right now are creating those statistics rising. Pattern interrupt, like I talked, we need to change that. What can we do to change it? We're working on that tonight. Mental health is one of the fibers. Mental health is one of the things that the team here and myself are all dedicated to, and more importantly, we're really dedicated to kids. You heard me talk about generational health. Where that starts is with kids. If you've been in the office with your child, you know how much we love kids and how important that they are. Our next piece of our philosophy and our passion is to treat the root cause. And I'm going to say that again because it is so important and it will follow through this whole seminar. Treat the root cause. Don't just treat symptoms. Symptoms are your body's sign telling you something's wrong. We don't want to stop those signs. We want to figure out why those signs are there and then take care of them. If you're treating those signs, then what ends up happening is the body finds a different way to communicate with you. So don't mask those signs. Listen to them. Listen to your body. So what are some of the things that you're going to learn tonight? The agenda for tonight is understanding the root cause. Root cause, core source, what is causing this problem? Then we're going to learn the polyvagal reset technique, a couple of different methods for it. You did learn what's called the eye technique, the 30 seconds looking each direction. Remember, if you wait till the end of the seminar and we get your email address, we're sending all these links and resources out to you. We're going to talk about food in your nervous system. Food is super important for the system. And parent empowerment, and then chiropractic care. All of those things are super important. We're helping create accountability for parents and for children by giving you this information. So along that theme, accountability, we're going to start with some clear boundaries. I always encourage setting clear boundaries, set expectations, and reach agreements in going forward. This is in anything within your life, but especially with your kids, especially if they're old enough to understand that. So what is this seminar, or what isn't this seminar? It's not about fixing your child overnight. I wish that were the case. They didn't, as with adults, we didn't get this way overnight. Kids didn't get that way overnight either. We're giving you some quick pattern interrupt fixes, but you're in this for the long haul. You've had a child. They are a part of your world. And so just focus on small steps. It does not need to happen overnight. So this is about equipping you as a parent. Children are in a growth phase and they need calm and confident leadership. That means everything that we're teaching you to do with your child tonight, you should also be doing for yourself. Super important. There's a little child inside of there too. I'm going to go back to symptoms versus source, or what you see, the body signs versus where this is coming from. If you're treating symptoms, that's just putting a Band-Aid on things. So if you're medicating, if you're doing behavioral modification, if you're removing screen time, those things are temporary. Not that I agree with limiting screen time, but it's not the source of the problem. The source of the problem is what's called nervous system dysregulation. So an example would be why one kid gets the same stimulus as another kid and they react differently. That's called resilience or adaptability. So this is the complex piece that I need you to keep your minds open for and hopefully start to chip away at this understanding. So symptoms versus source. The source is the nervous system. So stuff comes at us in our body, stuff comes at us physically, chemically, and emotionally. It comes at us, comes at children. Our nervous system then decides how to respond or react to that information. If there is interference in that nervous system, it's like glitches in the matrix. And there's the wrong response that ends up happening. I'm going to go back to when I was discussing nervous system, the sympathetic response and the parasympathetic response. So think about it this way. If you're stuck or your child is stuck in that sympathetic fight or flight mode, they're stuck there. Everything coming at them feels like they have to react with fight or flight. So those are their only two responses. It's not their fault and they have zero control over it. They're reacting normally. Anything comes at them, a little bit of physical stimulus, too much noise, just having to wake up in the morning, they react one of two ways, fight or flight. And they're stuck in that continual mode. That's their nervous system. That doesn't mean bad parenting. That doesn't mean too much stimulus. That means their body is not adaptable to it or able to handle it. I'm hoping to back you off and walk you off the ledge to say, find the source, treat the nervous system. So yes, the nervous system in the body needs nutrients. It needs all these wonderful things, but it has to come out of that fight or flight mode so it can be in rest and digest so that it can react and respond correctly. Making sense so far? Yeah, that one, once we get to that point, a lot of times there's a light bulb moment for parents that you get to the point where you don't blame your child. That is just their only response is how they can react. To not be mad at them, to understand that their whole nervous system is doing that to them as a protection. We'll get to where we can help fix that so that we can pull them out of that further. But I want to go over some side effects because the number one reaction when you have a child that is reacting in that fight or flight mode is to bring them into a medical provider, and medical providers or pharmaceutical providers will medicate. I do want to talk a little bit about that because that's the number one step that parents take and oftentimes teachers take. There are really two main classes of drugs, mostly known by Adderall and Ritalin are the two most common that get prescribed. They have many other names for generic versions of those. But what I'm asking you to do when you are going to another provider, into ourselves or into a medical provider, any type of provider, is what I've just educated you on. Ask where the root cause is, because if they can't tell you what the root cause of this disorder is, what are they treating? They're just treating symptoms. And if you treat symptoms, then the body's going to come up with another way to try to talk to you, because that's what symptoms are. They're just signs. And if you're just medicating and you're putting a Band-Aid on all of those symptoms, it's going to have something else is going to come out. It's not treating the root cause or the core source of the problem. So putting a patient or a child on medication, here's those common side effects to that medication: appetite suppression, difficulty falling asleep, stomach ache, which is one of the most common ones that we see, increased heart rate, blood pressure, mood swings or irritability, tics, emotional blunting, or feeling really flat. Those are all pretty scary to me. This is, I'm guessing that you all have seen some commercials where a medication comes up on the TV and then they list all the side effects. Most people are starting to go, well, I would rather have the illness than all of those side effects. It's pretty common. Just a side note, there is a proposed legislation going on right now to ban all pharmaceutical commercials on TV. I am pro that. I think that would be fantastic. That conversation about pharmaceuticals should happen doctor-patient, should not be advertising. That should happen where you can ask questions and there's a real conversation. When you go into the medical doctor, the question you should ask is, what's the core source of this problem? Where is this coming from? Let's treat that. When that comes down to it, I think chiropractic is really, truly going to be the answer for a lot of patients. Medication will not. The Ritalin and the Adderall, they're called methylphenidates. Methylphenidates are similar to methamphetamines, which most people know as meth. If I said to you, I think the answer is to put your child on meth, most people would be shocked. That's what the medical doctor is doing. They're just using different words. That's scary to me. Most people also know how addictive meth is. Also scary. Let's treat the root cause. Let's do it naturally, rather than putting our kids on medications. So when you treat this, when you're treating the symptoms or treating the side effects, not the actual cause, it's not a cure. It's masking those symptoms, many times creating new symptoms. And if it's not addressed properly, it gets worse over time. If you treat the real source and support the nervous system, decrease the interference in the body so the nervous system can react and respond accordingly, which we're going to teach you a few more methods of that. And then feed the body physically, chemically, and emotionally. The body learns to react and learns to respond appropriately. That's the natural method. I'm going to just go over really quickly with you the difference between, on your left side is medication, on your right is a natural and holistic approaches. And let's just walk through this. So the medication-based treatment primarily work by altering brain chemistry. Okay, that's not where the problem's coming from. Typically, it increases the dopamine and the norepinephrine to improve focus and control. It's fast acting, sometimes within hours, and often it's this first recommendation, the medication is by the medical providers. On the other side, we see the natural and holistic approach, which aims to restore balance in the nervous system, improves brain and body connection, and addresses the root cause. There's some positive and negatives to each. The holistic natural sides includes chiropractic, reduce nerve interference and regulate the body's responses. It also includes dietary changes, removing chemicals, removing inflammatory triggers. It's not fast. It takes time, but it is the long-term fix with minimal side effects, rather than the side effect medication-based type of approach. Natural approaches take more time. They take more commitment on your part, but they're side effect free, and then they build long-term resilience and adaptability. So what we're trying to do is shift your mindset from symptom-based to nervous system health. And that is from a medical medication, symptom-based mindset to a natural, let the body heal type of a mindset and support the way the body heals. Our job is to give you options and to offer you some control over some of the things that are happening. All right, next one is kind of we love sarcasm, kind of a sarcasm, but a fun story to talk about. So understanding the nervous system, let's say someone is, their airway is plugged or they're choking, where the air is supposed to pass freely through there and something's stuck in there. That's called suffocation. And if you see somebody choking, what is your natural response to do? Give them the Heimlich maneuver. For us, the analogy to this is the nervous system has interference with it. The nervous system is choking. That's called subluxation. The nervous system is not flowing properly. When we see that in office, a nervous system that's not working properly, it's like seeing somebody choking. And we want to go give the Heimlich maneuver. The chiropractic adjustment is removing that subluxation. The chiropractic adjustment is the Heimlich maneuver of chiropractic. And I know it seems kind of, it is, I'm being a little bit smart about this, but I want to give you the understanding of, put your mindset in, if I saw somebody suffocating, what would I do? That's the importance of, if you see something, a nervous system suffering, what would you do? Adjust that system. Seems simple, kind of complex, but super powerful. The nervous system is really governed. One of the main nerves is the vagus nerve. We did the polyvagus nerve reset earlier, the 30 seconds with the eye. And again, we'll get that information out to you in a summary to you of that. But I'm going to give you some other tools. First one is spinal molding. And again, we'll send this resource out also at the end. So each one of these 5 polyvagal techniques we'll send out with an explanation to each after the seminar. Spinal molding helps recreate the curves that are naturally supposed to be in the body. This can be done super simple. Roll up a few towels and lie on them before you fall asleep at night. Super easy to do with kids. One goes under your neck, one that goes under your low back, and it just starts reforming that curve so that that nervous system or the spinal nerves can flow freely. Another one is called box breathing. We're going to do a form of box breathing tonight. There's 2 different forms that are pretty common. One is breathing in for a slow count of 4, holding your breath for a slow count of 4, breathing out for a slow count of 4, holding your breath for a slow count of 4, and doing this until your system regulates, or we like to say about 10 times. There's another really powerful method. If you see your child in that caught up and you need to do a pattern interrupt, if they're caught up in that fight or flight mode, this one works really well. Have them do it 10 times. So we're going to do this together. What you're going to do is take a deep breath in, slowly counting to 4. Breathe in, 2, 3, 4. Plug your nose, tip your chin forward. Hold for a slow count of 4, 2, 3, 4. Then release the nose and the neck. Slowly breathe out for a count of 6. We're going to do 2 more of those. So deep breath in, 2, 3, 4. Plug your nose, chin forward, hold your breath for a slow count of 2, 3, 4. Release for a slow count of 6. Got it. Just slows everything down. Last one. Deep breath in. 2, 3, 4. Plug that nose. Chin forward so there's a stretch on the neck. Hold. 2, 3, 4. Slowly release that slow count of 6. As I'm speeding through all this information for you, you can tell it just slowed me down also. It works fantastic and it is so simple. Teach your child the tools so that they can do this on their own and they can recognize when they're caught in that fight or flight. Bring them right into that. And then if there's any conversation that you need to have it after they're in that rest and digest mode. Also, cold on their face or on the back of their neck will pull them out of that. It's short term. You have to do these things very frequently for the body to, as an exercise, memorize it, and it will get quicker and quicker to pull them out of that fight or flight mode into rest and digest. Rhythmic movement helps also. If you ever see a mom holding a baby, yep, it's instinctual in us. That rhythmic movement helps them. A rocking chair, any place that they can go to that is a safe, calm spot. A weighted blanket oftentimes helps. One of those things that just that hold them down so that they can feel safe, puts them into that polyvagal reset. Again, we'll give you a description of all of these so that you can start utilizing them immediately. What are you feeding the nervous system? This one we have entire seminars just on. What I would like to do is direct you to our website, rhcliving.com. There is a spot on there that is meal planning. In that meal planning, there is a very specific family meal plan designed for picky eaters. It's great for kids. It's great for what we call the Stearns County male meat and potatoes. It works great for those people. We've designed it so that it's easy stuff to do. You can find it in the grocery stores locally. You can, as a anybody can, you don't necessarily have to be a patient. If you go through our website and you sign up, it will ask you for your credit card information, but it will not charge your card if you cancel it within 30 days. You get 30 days to utilize this app. It's great for drag and drop. Like I said, use the template that we've created in there and then just say, oh, we don't like carrots. You search, you drag and drop, pull another recipe in there. It prints out a grocery list, prints out a calendar, prints out all of the recipes if you like, or you can just continue to use it online. You can change how many people you're feeding for. You can say, I want leftovers for 2 days. It works fantastic. My suggestion is that you weekly, and if you don't put it on your calendar, it doesn't happen. Weekly, set up a time to go through, dedicate that to meal planning. We all know it works. We just don't make the time to do it. Make the time to do it. This is one of the things that is immensely going to benefit your child. Food that people think is food in the grocery store right now isn't food anymore. It's full of dyes and chemicals and preservatives, and all of those are interfering with your child's nervous system. Eat clean. This is the part where I say there's no quick fix and it's a lot of work. When it comes down to eating and meal planning, it's one, the most important, and two, the hardest. Dedicate some time to do this. Side note, we do have a kids fruits and greens at a minimum. It tastes great, kids love it. We actually make popsicles for it. So if you ever want to stop by and just say, can I have a popsicle? We'll give you a kid's popsicle. You'll understand that they do like that. And that's something that they can put in their system daily to get their minimum required allowance for a day of fruits and greens, which is a fantastic, easy way to do this. Start chipping away at it then and working toward only clean eating. You really have the power. Routine is key. Be clear about boundaries. There are so many times that all of us in here are cringing the seventh time a parent says, if I have to tell you again, and we're like, bite your tongue is what ends up happening. So set clear boundaries, speak at once. Your child does hear you. Be clear. Consequences are fantastic with consequences within reason so that children learn. That's how we all learn. Set expectations and have agreements. Go through and do a polyvagal reset with your child and a small amount of information each time so that they're starting to absorb that. Follow through on those consequences. Offer options, not restrictions. My children, and I'm going to start this story out saying something kind of odd, but my children wore some really weird clothes to school when they were little because I never said no. What I said are, here are your options. So it was one day cowboy boots with dangles on them, sparkly heart pants, and a rainbow shirt. I'm like, you go. That was your choice. I think that's wonderful. What that teaches is their recognition of consequences. They didn't go to school without clothes on. Their recognition of consequences because they will get reactions and start to understand. I was there to be supportive, gave them options so that they are understanding the power that they have to make their own choices. And I think that's a fantastic thing to do for kids. Take time to take care of yourself. Super, super important. Use all of the tools that we've given and talked about tonight for yourself. And another thing, we have a mantra at the clinic. We have many mantras at the clinic. One of my favorites is we usually patients know this portion. Once you know better, do better. We have another piece to that. Once you know better, do better, but once you do better, teach and serve. And that is a portion of our service to others. That's a portion of what we strive to do in our mission every single day. I would challenge you that that's your mission too. So once you know better and do better, then start to serve and teach. Everything that we've taught you tonight, there aren't contraindications to it. Teach others, talk to others about this. You know, if you know anybody that has a child that is having some difficulties, tell them you have a great resource for them and then give them some polyvagal resets information. I think that that's a fantastic way to start that conversation and to offer some help. My favorite slide out of all of this, we've given you a lot of tools. I want you to know you're not alone. You don't have to do this all on your own. We've been talking about the core source of the nervous system in children and in the human body. Adjustments remove that interference. It's the Heimlich maneuver for a subluxation. It allows the body to heal itself. It increases digestion, improves sleep, decreases reaction, and increases response. More focused, less distracted for your kids. All of those things chiropractic can offer. So I'm going to talk to you tonight for just a minute, and then we'll finish up about a special offer that we have. If you want to have your child checked out, First We Love Children, please bring that child in. If you're a new patient, across the board, all new patients, they can bring family members in for a first new visit for free. Our established patients, if we haven't seen you for a while and you want to get back in, just call us, mention the special tonight. It's $47 to get back in for an adjustment. And any new patient kids, $47 to get you in so that we can take a look at those little nervous systems and those little spines so we can help you guys out to help regulate their nervous systems. Your child seriously deserves it. Their bodies are capable of so much more than you even realize. We love watching. We have a couple of kids in the clinic right now that we entirely have watched them go through the cycle of hyperactivity, bouncing off the walls, to calmly saying thank you when they go. And it's fantastic to watch. And that's just the power of chiropractic. So thank you for showing up. I know that I went a little bit over time. Thank you for making the time tonight. And thank you for listening, staying focused. We're going to send all of the resources out to you. There will be available a copy of the recording of this class. All of those resources we have links to, and we're going to send those out via email. And if you have any individual questions that I brought up tonight, please email us, please just text us, please call into the clinic, because we love kids and we love getting everybody feeling better. So thank you, everybody. Thank you.